The following program has been furnished and paid for by Ask the Expert Show. KSEV is not responsible for its content or the products or services offered. Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host.
And good afternoon. We do welcome you to another edition of Ask the Experts here on AM 700 KSEV, the voice of Texas. I'm Jack Gonzalez, and on this Sunday, we are going to talk about home health care, hospice care, something that's very important to a lot of our listeners. And of course, maybe you've got a family member that is in need of such services. And just a man to talk to you about that is Felix Scanabar with Avatar Home Health and Hospice Care. Hey, how you doing this Sunday, Felix? Glad to be with you.
Well, I'm doing pretty good. Beautiful day today.
Yeah, it certainly is. A nice day out there. Yeah, thank goodness we've been dodging that rain. We've been pretty lucky because it's been a little nasty in other parts of the country. Hard to believe that. So, Felix, before we get started, for our new listeners, I know you've mentioned it before in other shows, your background as far as your company and everything like that. So, for the benefit of some of our new listeners, let's just kind of go over, before we get started, about it in more detail about your services, how you came about and how long you've been in business. And also, you've got an award to brag about as well, too.
Oh, yeah. Well, basically, we started the agency back in 2006. So now we've been in business going on 14. We're in our 14th year of business. Proud to say that we're Medicare and Medicaid certified, and we have received accreditation from the Joint Commission. That is a gold seal of approval that our agency has received for meeting the criteria or the standards set by the Joint Commission. And the Joint Commission is an agency, an independent agency that is contracted by Medicare to make sure that all the healthcare providers in the United States, so I'm talking about hospitals, like huge hospitals, Methodist or St. Joseph or big hospitals here in the area, they will have to be accredited by an agency like the Joint Commission. So that not only do they inspect or make sure that we are doing what we're supposed to be doing, but they inspect hospitals, they inspect clinics, so they make sure that everybody's doing what Medicare is adhering to the Medicare practices and procedures and regulations. But on top of that, they have their own practices and procedures and regulations, which happen to be a higher standard than Medicare. So that's why if you look at the home health agencies in the whole state of Texas, only 9% of the agencies in the state of Texas have been awarded the gold seal of approval by the Joint Commission. And Avatar Home Health and Hospice is one of those agencies. So I'm very proud of having been there. And we have met these standards every year since 2000. Actually, we started the agency in 2006. They came to our agency in April of 2007. And ever since then, we've been able to maintain the high standards that they have time after time after time. They have awarded us with a gold seal of approval.
And Felix, I didn't mean to jump in there. When you talked about inspections, and it's very important for our listeners to know because, of course, we've heard a lot of bad news about, and not all of them are bad. Of course, we don't want to put that out. But there are some bad issues regarding nursing homes. And you guys aren't just inspected for just your ward, but you say you go through a lot of inspections. So you're checked on quite a bit, right?
Right, yes. We do. Normally, we get inspected probably once, twice a year by different institutions like Medicaid, because we're Medicaid certified, and for instance, our providers department, which is one of the services that we offer, so to make it clear, we not only do we do home health, we do hospice, and we do provider services. So that's like having three agencies in one, and that's also another thing that is very unique about Avatar Home Health and Hospice, is that a patient doesn't have to be going from agency to agency to agency to get the services they require. By joining Avatar Home Health, which is free services, we will be able to take that patient from home health to hospice, to provider or caretaker services. We also offer palliative care. So we have an array of services where the patient can stay home and get all the services at home. So because we offer so many services, we are monitored by Medicare, by Medicaid, by the Joint Commission. Then you have OSHA, and you have all of these different governmental agencies that can come in anytime. The Texas Workforce Commission, or any of these agencies that can come in at any time, do an inspection to make sure that we're following their regulations.
And these aren't inspections planned in advance, right? They'll just show up at your door. So, it's not like we got to make sure this, to put on a false facade of your service, because they actually see how you work. And so, and you get your accreditation based on that, right?
Correct. What they do is they just come. They show up at your door, say, here we are. They show you their ID, and then you have to make them comfortable. You have to give them access to their computers. You have to give them access to all your data, all your records, and then they will tell you, okay, we want to go with your nurse to go see 2 or 3 different patients. They pick the patients that they want to see, and we have no control over what they do.
So they actually monitor with them working right then on the spot. They'll see how they work.
Yeah, which makes the nurses a little bit nervous, because they have to show up to the patient's home with an inspector right next to them, and they know that they are under the microscope. So many nurses say, oh my God, I was so nervous. Nurses with 10, 15 years experience, they go, that nobody likes to have somebody looking over their shoulders while they're doing their jobs, But it doesn't really matter, because really every inspection that we have had, we have always passed. They might find a minor error that we're doing in the paperwork, but that's all right, because no one is perfect. But when it comes to patient care, when it comes to the most important thing that we do, which is the hands-on help that we provide the patients, we've been perfect so far in all these 14 years. And a good testament to that is that when on the Medicare standards, they measure us in 7 areas. We have been either at 100% or close to 100% on all those 7 areas. And the ones that we haven't been, and in every single area, we're above the national average. So when you compare Avatar Home Health to the national average nationwide, nobody else, we're better than the national average.
That's not bad, 100%. That's a really good when you get them for so many scores, too. That's something to really be proud of. And for our listeners, once again, it's passed on the phone number. That is 281-703-8050. And that is Felix's personal phone number, his cell number. He's got his phone right now with him, as a matter of fact. But don't try calling him now. But he is there all the time. So if you need more information, or if you'd like to talk to Felix about your services, just call him and he'll be happy to take care of you with that. And Felix, let's go into a little detail about as far as your services. I mean, I know you talked about the nurses coming to the home, but let's get into a little detail as far as the services they do provide once in home, and some other the home health care that you might want to touch on that your service provides.
Sure. So basically, when a patient comes out of the hospital, or they go to the doctor and the doctor refers them to our home health agency, they're going to tell us what they think that we need to do to the patient. We could be wound care, it could be to manage their diabetes, make sure that they're taking their medications right. They might have a catheter, they might come home with an infusion. So whatever the situation is, the doctor or the hospital are going to give us orders as to what to do. So the first thing that we do is we send a registered nurse to do an assessment. So the nurse has the orders from the doctor or from the hospital, and we go to the patient's home, and our main purpose is to keep that patient from going back to the hospital. Because believe it or not, the hospital, and we'll be touching on this a little bit later on the second half of the show, because the hospital is if you have to go to the hospital, go to the hospital, but get out of there as soon as you can, because most infections are transmitted in a hospital setting. So a hospital is good, but get out of there as soon as you can. So we don't want the patients going back to the hospital. So once the hospital discharges the patients, we follow their instructions. Our main concern is to make that patient better and become stable again and independent, but also keep him from going back to the hospital. So that's our main purpose. So as far as what we can do almost anything. So short of surgery, we can do almost anything that the patient gets done at the hospital, we can do it at the patient's home. So that's very important for people to know. And also, we offer, like, say a patient's going to get a nurse to go visit them 1, 2, 3 times a week, depending on their needs. They might also get a home health aide, that is someone that's going to go to the patient's home, make sure that they can help them take a bath. If the patient cannot leave the base bedbound, we give them what is a bed bath. If they can go to the shower, we make sure that they get a shower and they're safely, we safely move them from the shower to the bed. So we make sure that the patient is taken care of not only by the nurse, but a home health aide. If they need physical therapy, occupational therapy, speech therapy, we'll help them with that.
And Felix, I'm sorry, I just wanted to jump in here. We're about to go to our break, but when we come back, we're going to talk more about what your services provide, and also we're going to get a little bit more detail about, you mentioned the palliative care, so we're going to talk to our listeners about that, and still other services that you guys provide. So stay tuned. We'll be back with more of Ask the Experts here on AM 700 KSEV, the voice of Texas.
Do you or anyone you know need help with your daily activities, grocery shopping, bathing, cleaning, cooking? If you do, Avatar Home Health and Hospice can help you. Avatar Home Health can also help if you need nursing services and or therapy services in the convenience of your home. If you live in Harris or Montgomery County, in most cases, they can start services within 24 hours of your calling them. Avatar Home Health and Hospice was established in 2006. Avatar Home Health and Hospice is not only Medicare and Medicaid certified and licensed and insured, but is one of the few agencies that has received the Gold Seal from the Joint Commission. This accreditation has only been granted to less than 9% of the agencies in Texas. At this time, Avatar Home Health and Hospice takes care of over 340 patients. Whether it's home health, hospice, or caretaker services, one of their 220 professionals will be assigned to help you. Avatar Home Health accepts Medicare, Medicaid, United Healthcare, Aetna, Molina, Humana PPO, and other insurance companies. They also accept private pay patients. They can also help you find what benefits you qualify for. Most of their services are paid by Medicare, Medicaid, or your insurance company most of the time, without any out-of-pocket expense to you. Call Avatar Home Health and Hospice at 281-703-8050. That's 281-703-8050. Or email them at info@avatarhomehealth.com.
And welcome back to Ask the Experts here on AM 700 KSEV, the voice of Texas. I'm Jack Gonzalez, and if you're just tuning in, we are talking to Felix Scannabal of Avatar Home Health and Hospice Care. He's telling us all about the great services that he provides for your say your loved one, or maybe you might be looking for this type of service yourself. So, Felix, before we broke, you were talking about some of the medical services that you provide at Avatar. And, of course, we want to stress to our listeners, this isn't something that you say that the patient needs, but you're following strictly doctor's orders, correct?
Correct, yeah. We go by without doctor's orders, we cannot provide home health nor hospice care, or palliative care for that matter. So, the only service that we can provide without a doctor's orders is the provider or caretaker services. For those, we do not need orders from the doctor. But for home health, hospice, and palliative care, we have to have a doctor's we have need doctor's orders, and we always have doctors involved. Remember that as a hospice agency, as a palliative care provider, we have 2 medical directors on our staff. We have a number of nurse practitioners also that work with us. We have registered nurses, vocational nurses. We have home health aides, doctors, social workers, nurse practitioners, therapists. We have a number of professionals that are helping our patients get better. Jack, another thing that I'm proud of, besides our gold seal of approval and having been in business for 14 years and so on, is that talking about our staff. Avatar Home Health started in 2006 with actually 3 employees, right? Today, we have approximately, it fluctuates between 210 to 225 employees. So we're not the biggest agency in Texas nor in the Harris-Montgomery County area, but we are large enough to help to have all kinds of services for our patients. But then small enough where every single one of our patients, and right now we're taking care of approximately 400 families, meaning that we're taking care of somebody in that family. Every single one of those families that we help, they all have my cell number, which is the one I give out on the air, which is 281-703-8050, 281-703-8050. And these families, and I tell them, because I talk to each of these families individually when they first come onto our services, and I tell them, if you need something, if you see that you ask for something and we haven't come through with it, if our nurses or our caretakers are not of your liking, please give me a call and I will take care of the problem immediately, So that's something else that no other agency that I know, because I know a lot of home health owners, and they think I'm crazy. He says, I would never give out my number to the patients. I said, well, I do, because I have such confidence in my staff that I hardly ever get a complaint on the phone. So, so those are those are the intangibles that patients do not get with our agencies, but with Avatar Home Health and Hospice, we go that extra mile.
And you don't get very many complaints, because we've read testimonials from some of the people you provide your services to, and we've even had a phone interview with one, and they all love your services. In fact, when it's time for it to end, they say, "Oh no, and I'm not saying that, folks, just to sound good on the radio. I've actually read these testimonials myself and spoken with these people. So you do have some very good, caring medical people who look after the patients and do such a good job. They give such great compliments on that. So that is something to be proud of too. Hey, Felix, let's talk about some of the other services, because of course we were mentioning the medical stuff, but there are other things outside of medical that your employees provide to the patients, as far as like maybe cooking. Shopping a little bit. So why don't we jump into a little bit in that and talk about that part of your service as well, too?
Right. Yes. Basically, we also provide, we provide home health, we provide hospice, and hospice, just to touch on it a little bit, is for those patients that have a terminal illness and the doctors have determined that there's much else that they can do for them. So then we treat them at their homes in hospice. Then we do the provider or caretaker services. And those are services that are either paid by Medicaid, by long-term care policy, or by the patient themselves. So there, what we do is we have a trained home health aide or provider that will go to the patient's home anywhere from 1 hour a day to 4 or 5 hours a day, depending on the needs, depending on the insurance coverage or the patient's budget. And we help them clean, we help them go to grocery shopping, go to the pharmacy, escort the patient to the doctor, help them taking a bath, washing, doing their laundry, washing their dishes, whatever they need to make their lives easier, So those are services that that's something everybody wants. Every single one of our patients want caretaker services, and in the caretaker department, we have approximately 200 families that we help. So those are also services that we provide.
And so, Felix, and a lot of people are listening right now. By the way, let's give out your phone number again. That's 281-703-8050. That's 281-703-8050. And so a lot of people are hearing this. Okay, great. Okay, so how do I go about paying for all this service? But that's something else you provide. You provide help as far as letting them know, you research their background and see what they are covered and what they're not covered for and how much they have to pay. As you were saying previously, there are some services they may not have to pay because of their insurance, correct?
Right. Most of the services we provide are at no cost to the patient. So that's why when somebody calls me, all I ask them at the beginning is name, date of birth, and Medicare number. With those three pieces of information, we go into the Medicare database, and there we find out what kind of insurances they have, whether they have Medicaid or not. So once I get that information, I can call the patient. And this jack normally takes me, 15, 20 minutes. I call the patient back or the caller back, and I say, okay, we can provide you, like for instance, home health, hospice, and palliative care. In most cases, there's no out-of-pocket expense to the patients.
Wow, that is great. Hey, Felix, let's touch on a couple other things before we close. I mean, we do still have a few more minutes, but some other things we want to talk about. Of course, coronavirus, big in the news these days. And talk about that as far as how that is affecting your services and what you can do as far as people, despite this unfortunate thing that's going on in our country right now, and worldwide, as a matter of fact.
Yeah. Okay, so coronavirus, believe it or not, I thought, well, now with the coronavirus, maybe the doctors are not going to be referring patients to us or something, but that hasn't happened. Actually, we're getting the same number as referrals for our services that we were before this virus broke out. And the reason being is that, once again, our job is to keep that patient from going back into the hospital. Even without the virus, you never want to go into the hospital unless you need to. But now with the virus, the hospitals don't want a lot of patients because they're getting ready for this avalanche of patients that are supposed to be needing hospital services. So it is very important, and even if you're not getting services from Avatar, if you're listening to the show and you or one of your loved ones is getting services from a home health agency, do not cancel your services. The nurses are prepared. They understand what to do in order not to transmit the virus and stay safe. Do not keep the nurses from visiting you, because the main reason that they're there is to keep you from going into the hospital.
And to monitor your situation. I mean, what if they do notice you're getting a little bit sicker? Then that way they can let somebody know. But if you're not having that medical care, then no one's going to know, and then you might not get the medical attention that you might need. Speaking of the nurses, before we do close out, Felix, you've got so many employed, you said, but you're still always looking to hire nurses. And also you mentioned you have another position coming up that you would like to mention, that you want to let people know out there, who are nurses who would like to look for some extra work, that you might be hiring them. How would they go about letting you know?
All they need to do is call me at 281-703-8050, or they can actually log into avatarhomehealth.com. And we have a very short application there, just asking them for just contact information, and we'll call them back and set up an appointment. We are hiring RNs and we're hiring LVNs. Now we also have an opening for an MSW, a Master in Social Work, to help us with our home health and hospice patients. So please, if you're looking for the social worker, it could be on a part-time basis if you want to. But nurses, I need nurses to be full-time. If they need to work part-time, we can work something out depending where you live. But yes, I'm always looking for nurses, and all I ask you all we require you to be, of course, is to be licensed and to be compassionate. If you lack experience, if you need training, we are very, very strong in training our nurses. So please, if you're looking looking for a job, or if you're not a nurse or a social worker that's looking for a job, please have them call me at 281-703-8050.
Do you want them to go to the website? Can they apply there too, or do you just want to strictly get phone calls regarding that?
Oh, no, they
Felix?
can go to the website, to avatarhomehealth.com, and they can complete the small application there, and then we'll call them and set up an appointment.
And that's
Yeah.
Avatar spelled AVATAR, and of course, homehealthcare.com. Hey, Felix, it looks like we're out of time. Boy, it was a fast
that was
session.
fast.
Yeah, well, when you're working with a professional like Felix, it's just so easy, right?
Thank you.
Hey, Felix, thank you for joining us for another edition of Ask the Experts here on KSEV. We certainly appreciate it. And once again, that phone number, 281-703-8050. I'm Jack Gonzalez. That's Felix Cannibal of Avatar Home Health Care. We thank you for listening to another edition of Ask the Experts.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.